It's my pleasure to introduce the second panel discussion for today. And we are going to be talking about setting the standard. Health empowerment for young women is what we're going to be discussing today. We're going to look at how young women can take control of their own health journey, the power of prevention, and also confronting some of the big issues around health anxieties that young women are facing. So I've got four fantastic women on the panel with me today. I've got Justine Salisbury, is here from the Ministry of Health. I've got Alexis Wolfe from Endometriosis Australia. And then I've got both Anita and Trudy. Anita? Yep. Anita and Trudy, who are both, Anita is from the Cancer Council, New South Wales, and Trudy from Cancer Institute, New South Wales. So welcome. Now, Alexis, I'm going to start with you.
Sure.
We actually already had this raised today about the sort of length of time between diagnosis for women with endometriosis.
Yes.
Why is there still such a delay, particularly in diagnosing health issues that impact women?
It's an excellent question, and it doesn't just revolve around endometriosis. I think one of the things that we've observed with our patients is that there is a real stigmatism and myth that painful periods are normal, and that is a common explanation that is perpetuated through families and friendship groups. So if your mum perhaps had painful periods, or your grandmother or your auntie, there is a story that, well, that's just our family curse and you just need to suck it up and get on with your life, which we know that that is not true. And whilst it might not always be endometriosis, it's still something that should be looked into and should be persisted with. So there's a really large stigma around period education. And so it's not something that people generally in their young years actually go and seek, I guess, conversation with their GP about. It's a bit of an awkward conversation. Maybe someone's not comfortable talking with a male doctor, they prefer a female doctor, maybe there's not a female doctor in their specialist area, and so it's one of the reasons that certainly perpetuates it. I think the other reason that we've noticed is that the length of time that is normally allocated to a GP consultation is quite short. Now, if you think about the symptomology of endometriosis being very broad, so one of the symptoms is fatigue, the other one could be bloating. Now, those symptoms could be any number of diseases, but if you're not taking the time to actually have a conversation with your GP at length about what your symptoms are, then it's going to be very hard for your GP to start raising some of those flags. So we really need to educate young people that booking a short consultation with their GP is good for things that they are very confident that they know about, but if it's something that needs to be investigated, booking a longer consultation is actually really beneficial, because it means that your GP will be able to really investigate some of the symptoms, try and help you work them out, help you perhaps to track them if you haven't already been tracking them, and then get you on a bit of a plan.
Yes, okay, I think that's really good. I did mention earlier today that I have had a number of health issues, and endometriosis is one of them.
I'm so sorry to hear that you're part of that club.
Yeah, I am part of the club, and I certainly had that experience as a 19-year-old. I was very uncomfortable talking to even female GPs about it, just because it felt, it's quite intimate. And I think as you get older as a woman, particularly if you ever have children, you become very comfortable with just the, handing over control sometimes of just bodily dignity. But yeah, certainly for young people, it's a big deal. And I also think it's hard when health conditions can fit into a few different boxes. It's not always the case that you turn up and it's a ticker box exercise, so we can.
Absolutely. And we find that a lot of young people, they'll seek perhaps health education or support first from a dietitian or a naturopath, because they think it might just be IBS. But actually we know that there's a quite close correlation between IBS symptoms and endometriosis, and so they end up being sort of misdiagnosed and think that it's just a dietary thing that they need to worry about, but actually that's not really treating the root cause. And then, once they get into their 30s and perhaps think about starting a family, that's when sort of some of these things rear their ugly head, and they start putting together all these symptoms that they've had for many, many years and think, that's actually what it was.
Yes. Yep. Now, Anita, I wanted to ask you, what behaviours can women start modelling in their younger years to optimise their health now and in the future, and I suppose the way they manage their health?
Oh, that's such a great question, because there are so many things I think that spring to mind that I could rattle off. There's probably what I would call the foundational elements, which aren't necessarily the topics of the day, although there are a few at the moment that I'm going to call out. But the foundations of really healthy eating, so making sure that we've got good fruit and vegetable consumption. We know right across New South Wales that fruit and vegetable consumption, we're just not hitting the Australian dietary guidelines of 2 fruit and 5 veg. Veg is, I think we're not even hitting 2 out of 5. So I think, that's a really timely reminder, not just for, young women, but all Australian women to really be focusing on increasing our vegetable consumption. The other key element as well is around being physically active. Now, both of those factors play such an important role in influencing our body weight as well, and maintaining a healthy, not only body weight, but healthy image of ourselves. But I think across New South Wales in particular, where we have, 1 in 2 adults who are overweight or obese, we're living in an age where it's just so easy to be sedentary, to not move. Obviously, COVID lockdowns haven't really helped with that. But making sure that we're aiming, as women, to be getting a minimum of 30 minutes of moderate to vigorous physical activity every day helps not only in terms of keeping a healthy lifestyle, but also contributing to a healthy body weight. So they're kind of those foundational elements that I would call out. Absolutely making sure that we're, preventing the uptake of smoking, or if you are a smoker, to quit. Then there are what I would probably call out some of the issues of the day in particular at the moment. And one that we're seeing really emerging quite rapidly and quite alarmingly is vaping. It's becoming an incredibly hot topic, and has been for the past 2 to 3 years, particularly in the media. It has certainly been positioned by industry and retailers as something that could be the magic bullet to help people who have really finding it quite challenging to quit smoking, that this could be the it thing. Unfortunately, when we have a look at these products, and they're no bigger than the size of a highlighter, and they're flavoured fairy floss or bubble gum or unicorn, and they've got cartoons on them. Now, these are the types of products that you wouldn't think are geared towards people who are heavily addicted smokers, who have been smoking a pack a day for 30 years. These are becoming quite rife amongst, in particular, secondary school students, and we get contacted by parents at the Cancer Council New South Wales who are finding it as young as year 5. So at the moment we're undertaking some research to get a really better handle on this particular issue, but the current estimates in secondary schools is that we have between somewhere to 35 to 55% of secondary school students who have used these products. Now, as young women and as mothers, I think it's something to be really, really mindful of, that these products might not necessarily identify as containing nicotine, but when they are seized and when many of them are tested, they are found to contain nicotine, and that's an addictive substance. And when it's being used by a secondary school student or an adolescent, a teenager, the influence that nicotine consumption at such a young age can have on mood, attention, irritability, concentration, they're just little things to watch out for. But that's one of those it topics that I would absolutely just have on our radar as something to watch now, and particularly over the next probably 1 to 2 years.
I almost can't even speak, because as you said that, I just feel really confronted. 35 to 55% of secondary school students, that
have ever tried that kind of a product. And, teachers and school principals are certainly dealing with it at the forefront, at the coalface, I should say, because these are types of products that are being traded, are being used, are being shared amongst schools, and as I said, very easily disguised in pencil cases.
Yes, okay. I'm also just sitting here thinking, isn't it wild that we can sort of move to the point we are in the response to smoking, where we're certainly, I know it's not perfect, but we're heading in the direction of that being minimised, and yet we've got a whole new frontier now.
That's right.
Trudy, I might ask you that as a similar question about what are the sorts of things that you would like to see young women modelling to take care of their own health and well-being?
Absolutely taking advantage of the amazing national screening programs that we have. For women 25 and over, the cervical screening program should absolutely be a priority. If you're a woman 25 and over and you are sexually active, whether that's just the one partner or even a same-sex partner, please go and have your cervical screen every 5 years. So I can't champion that enough. And just in terms of vaping, as a parent, I find it, it's very confronting, the change in attitudes towards smoking.
Yeah, how interesting. Justine, I might ask you there about how young women can prevent and manage sexually transmitted infections.
Okay, so for any young woman who is sexually active with one or more partner, whether or not they're using protection, condoms are a good way to protect yourself against sexually transmitted infections. But we do know that most sexually transmitted infections can be spread in other ways, even if you are using condoms. So they could be spread orally or other ways as well. So we do suggest that any young girls see their GP and have a regular test for things like syphilis, for hepatitis C, hepatitis B. We know that all of these have good treatment options, if not a cure. We know that hep C now has full treatment and can be cured if caught early. And we know that hepatitis B, in some cases, most of the girls have had their hepatitis B vaccination, but they may not have seroconverted. They might still be able to catch that virus as well. So, but also in the case of syphilis, syphilis has been on the rise lately in not just regional New South Wales like has been in the past, but definitely we've seen a 500% increase in the major cities where women who are pregnant have been tested for syphilis, and then that goes on to have very poor consequences for their babies. Congenital syphilis has increased at a very high rate, and we're hoping that we do get more women tested, especially in the early parts of pregnancy, if not before they fall pregnant, for syphilis. And the reason why we also do that testing within pregnancy, because they might still be sexually active or their partners might still be sexually active. So we just want to make sure that we cover that off, because the consequences of congenital syphilis are sometimes fetal demise or very poor outcomes for the baby's development. So sorry to be that was very confronting. But yeah, so the message is get those for young women especially, get them into regular testing, making sure that they're looking after their own sexual health. It's very empowering as a woman to take control of your own health, and looking after your own health in that way is very beneficial. And it's free in most cases. Or if you don't want to go to the GP, there are other options. There are free testing clinics provided by the government. And in the case of hepatitis C screening, there's also you can go on the hepatitis C website, and you can get an over the website tests sent to your house, and you can do that test at home. So get that sent back in as well.
I would love to just get a sense from the audience, because that 500% increase I find quite staggering. I'm not familiar with that. I'm assuming that the people in this audience are fairly engaged in women's health. Can I just ask, is that known among people here that the syphilis spread? Is anyone across that? Well, that's quite extraordinary, isn't it? And screening is ultimately the solution.
Yes, so syphilis is actually an infection that can be treated with an antibiotic during pregnancy, so that can also solve the problem.
And so this might be a silly question, but what is leading to that? Like, why has it jumped so considerably?
It was the first issue was it was spreading amongst vulnerable populations, but now it's coming into the cities. I think it just is, unfortunately. It's a sexually transmitted infection. It's like anything. If it's not protected against, then it will spread. So I think that's really the message that we need to get across. Firstly, protect yourself. Young girls, use condoms, use dental dams, the things that actually prevent the infection to start off with, but also have that regular testing at least every 6 to 12 months. And that's the way we can then, if we find syphilis in a young woman, we can give them some antibiotic or a treatment that can treat that.
Fantastic. The next question I have is, I guess it's quite fitting, because it's talking about how can we assist young women when they're feeling anxious or overwhelmed. And I'm just going to be honest with you, I'm feeling anxious just with the combination of the rise of vaping and syphilis. I'm feeling overwhelmed and anxious. Alexis, do you have advice for, I mean, obviously in your role in Endometriosis Australia, I'm sure you work a lot with young women who are overwhelmed and have anxiety.
Yeah.
What's your advice?
It can be a little bit different for endo worries in the sense that they feel overwhelmed and have anxiety because if they are picking up on symptoms and they're not necessarily getting the support from their medical professionals to connect those dots, they can feel like it's all being made up in their head and that they either have a really low pain threshold or that maybe they're just connecting things that aren't actually things that we need to be concerned about. So for us, it's more about trying to continue to get them to self-advocate and really, I guess, protecting themselves and their own mental health when they are having those repeat conversations with GPs or other specialists. So getting a second opinion if you're not comfortable with the person that you've spoken to. If your symptoms are persisting, seek someone else out, I think is really important. Bring someone to an appointment as a support person if you need them there, because that can also help, particularly if you're retelling your symptoms or your story. It can be quite traumatising to actually relive that over and over and over again. So having someone that is there to help you to do that is also really helpful. So there's some of the things that we've noticed with our patients, and it can be very helpful for them to be able to make sure that they feel supported and that they do eventually get the support that they need.
Yeah, that's fantastic. Trudy, what about...
Yeah, I wanted to add to that. If you're not comfortable having your cervical screen with your doctor, find someone else. It's very important. We are on track with the national screening program and the vaccination program that's being rolled out in schools for HPV. We're on track to eliminate cervical cancer by the 2030s. So I think that's a great shared goal of hope for all of us. But yeah, if you're not comfortable with your doctor, find another one. It's really important. Thank you.
That's a great piece of advice.
And perhaps ask friends. You know, if you trust your friends, then ask them for advice as to what GP or person that they might actually see, because it might give you the confidence to then go and see that person yourself.
Absolutely.
The best option versus Googling and just seeing someone out the
And I guess, I mean, part of that, and I touched on this earlier with my own experience of trying to find the right, medical person when my symptoms didn't fit into one box. You do feel quite almost like I felt a lot that it was my fault that they didn't have the answer, and I think being empowered to actually say, do you know what, this doesn't feel right to me, I'm going to seek out someone else. It actually takes a little bit of courage, because you're sort of pushing back on something, when a doctor says to you, oh, don't worry about that, but if it's a concern. Anita, what about you? What are your sort of tips when you're, on this subject of young women being overwhelmed or anxious related to their health?
I think there's definitely two things that I'd want to call out there. Particularly on the back of COVID and lockdowns, we did see some interruptions, across all demographics, with but including women presenting to healthcare professionals. So, whether it's respect to screening and making sure that if you are overdue for a cervical screen or a breast screen, don't delay. I mean, there's an element of knowing that everything's okay. So I think as women, we're very good at putting things off and putting everyone else first. But obviously your health is so critically important, not only to yourself, but those around you. So prioritising any health checks, whether it's screening, skin checks, if there is a conversation you've been putting it off, that it might be uncomfortable, go ahead and have that conversation with your health professional. Prevention is always, wherever possible, better than cure. So I'd certainly encourage, if you are overdue for any health check, to go ahead and see your GP. And the other one for the mums, and that includes myself, I've got an 8-year-old going on 18. It's just a reminder that, the behaviours that we model are seen by our children, and there is such an important role that we play as important role models in championing our own health behaviours, our health checks. They are things that our daughters will see. And so if you can't do it for yourself, definitely do it for the generation beneath you.
Yeah, that's a fabulous piece of advice. I'm going to open it up if anyone in the audience has any questions. Yes.
It's not a question, it was just for people to know about. There's a thing called Get Papped, which I don't know if you've heard of. It's what girls will go on and put where they got their cervical screen if they had a really nice doctor, so that other people can go there.
I did not know that.
I love that.
It's called Get Papped.
Awesome.
Really good.
Good use of social media.
It is.
That's great.
Pregnancy as well.
Fantastic.
Women that have found a female doctor that they've really got on with breast everything.
Yeah.
It's really good.
Okay.
Spectacular.
It's gone through the whole of Australia now, so it's quite.
Okay.
Great.
Love
My peers
that.
probably know about it, but I don't.
Really good.
Yeah, fantastic. Thanks so much for sharing that.
Get papped. Can I actually just ask quickly, how often are you supposed to have your cervical screen?
Every 5 years.
Every 5 years. Okay, excellent. We've got a question.
Can I ask two questions? One to Justine and one to Alexis. So Alexis, young girls who are having painful periods, how do we increase the awareness of what to expect if they go to have a conversation with a doctor and the tests? Because some of the tests are quite invasive. And is it easy to diagnose? Yep.
Two-part question, complicated. So endometriosis has a national action plan for endometriosis that was created as part of the Federal Health Department. As part of that, there is a funding for a project through one of our very great organisations called the Pelvic Pain Foundation of Australia, and that project is called Pep Talk. It is the Pelvic Pain and Endometriosis Program. Now that specifically goes and talks to young women and boys at school about pelvic pain and endometriosis, and it's about trying to get that education at that lower level so that they can actually understand what is normal, what is not. Because, you know, if you have a friendship circle where everybody else has a very minimal symptomology when they have their menstruation, and you're the only one that does, you can feel quite isolated and you just think it's your fault, as you were sort of mentioning before, versus that there's actually something wrong. So that program, continuing to get that across all of the states and territories, is really important for endometriosis as a cause, because we think that it's really good to get in at that level. The second part of your question was, is it easy to diagnose? It's not. Part of the challenge that we have with endometriosis is that there's more questions than answers, and that generally happens in many women's health issues where there's been a lack of funding. So what we know is that, generally speaking, there are 4 stages of the disease, stages 1 through 4. If you were to get a pelvic ultrasound through a very good pelvic ultrasound location, you may be able to see endometriosis when it's in stage 3, stage 4. But stage 1, stage 2 may not be very apparent, but we know with the stages that pain levels have no correlation. You could have stage 1 endometriosis and be in the emergency room once a month. You could have stage 4 endometriosis and it could be silent, and it's not perhaps until you go and try and have children that you realise that there's some issues, and that you then go and have further testing to work that out. So we really want to get more funding and research into how we can better identify endometriosis through a pelvic ultrasound. It is uncomfortable. It is not something that many young people actually want to do. It's quite, intrusive, particularly if that young person is not sexually active. It can be quite, confronting for them to actually have to go in and have that test. The alternative is to have a laparoscopy. Now, for those that don't know what a laparoscopy is, it's keyhole surgery. You end up with between, 2 to 4 incisions in your stomach. It is a day procedure, but it can take anywhere between 2 to 6 weeks for recovery. It's invasive, it's expensive, it's hard to find surgeons that can that can actually operate on your endometriosis, but based on where it is, how prevalent it is, what other organs it's touching. If it's touching your bowel, we might need a bowel excision specialist also in the surgery. So it's very invasive to be able to be diagnosed clinically with endometriosis, and that's really some of the barriers that we experience. So we as Endometriosis Australia are investing in grant programs to try and find alternative ways to research treatment options and diagnosis options, because for a 17-year-old young person having to get a laparoscopy to diagnose their endometriosis and to have that removed, that really should not be the first option. We should have alternative options, and that should be the absolute last resort, that we put someone through a surgical procedure that's that invasive.
Sorry, I had a second question, if that's not hogging. So Justine, just the alarming rates of sexually transmitted infections. Again, that stigma of going to see your GP to be screened, I mean, even admitting you're sexually active as a young adolescent, or so how do we improve getting younger sexually active teenagers to be screened or even think about it?
I think that takes us back a little bit to modelling behaviours. I think as a parent, I think as parents we must make sure that we model the behaviours that are good health behaviours for our children, and that comes with both sexually transmitted infection testing, being that advocate for your child to let them know that this is something that needs to be out in the open. Yes, sex isn't horrible. It isn't a no-go zone in anyone's conversation. It should be out there, and they should be able to come to us if they're concerned. And being able to ask somebody that they can trust should be the parent first. If it's not, then it should be a GP that they can trust as well. I don't know how to make it easier for anyone. I think it's a very individual thing, but I think it's up to us as health to make the messaging very clear to people that these services are available. I think by making that message a general message to all people that everyone knows at time points in their life where it's important for them to know, so bringing it into schools, like we were talking about periods and stuff earlier in one of the other discussions we had, bring into like day-to-day health conversations in their PDHPE. Bring it into their school curriculum, bring it into the home for an open conversation with parents, and the parents actually going, if you're sexually active, I can take you there, or even if you don't know, take them there anyway, and introduce them to that GP, and introduce the fact that that could be done at any time, normalising the conversation, making it safe.
I absolutely agree. I think normalising, for example, normalising cancer screening in the family, it's so helpful for young people to grow up seeing their parents and family members participate in routine cancer screening with a view to wellness, not about ill health, but with a focus on wellness and control of your own health. And I think that's a really great, that could be applied around the board with sexual health screening as well.
We are nearly coming to the end of this session, so if there are no other questions, I might take this opportunity to thank everyone on the panel. Justine, Alexis, Anita and Trudy, thank you so much for your time today. And I think there's some very empowering, important messages that you've shared today. And I think it is really, it is empowering to consider the role that we can play in managing our own health, but also in sort of modelling that for the younger people in our lives as well. Stigma keeps coming up today. It's such a sort of, it's relevant to all of these issues. And I think it is, women's health is particularly stigmatised because so much of it is the more intimate components. But thank you very much for the work that you're all doing to make that better. So thank you very much.
Thank you.